Good evening, everyone. I'm Connie Gonzalez. I'm the Director of Strategy and Community Relations at Brooks. Welcome to this second installment of our Ask Brooks series. Today, during our session, we are bringing community leaders to answer each of your questions. Tonight, we'll be having an open discussion about mental healing and coping in a COVID-19 world. We all know social distancing, quarantine, and isolation can be overwhelming and cause at times strong emotions. And so finding ways to cope with stress in a healthy way will make you, the people you care about, and our community stronger. I do want to recognize the two speakers that we have today, the President and CEO, Mr. Michael Klein with Mission Trail Baptist Hospital, the largest tenant right here at Brooks. Michael, thank you for joining us.
You're welcome. Thank you for having me.
And we have Vanessa Bernal. She's a local licensed marriage and family therapist and licensed professional counselor. And Vanessa also happens to be my sister. Vanessa, thank you for joining us.
Thank you for having me too.
Up on the screen are some resources that you, our viewers at home, can access if you or someone you know is needing assistance. And we'll be posting this throughout the broadcast so that you have access to it. Before we get started, I would like to go over a few housekeeping items so you know how to effectively participate in today's event. At any time, you can submit your questions to our speakers. To do so, just type your questions into this live stream, and as time allows, we'll do our best to address as many questions as we can. This stream is also being recorded, and so make sure to tell your family, your friends, anyone that was not able to make it right this second, that it will be posted on our page after the event. And it will also be televised on the City of San Antonio channel TVSA this Sunday at 7 p.m. So now that we've gotten a few of that housekeeping items out of the way, we can begin by digging into some questions that have already been pre-submitted. And so we'll start off and open up the question to both of you all, Vanessa and Michael. Can you offer up your perspective? So how do you think the perception of mental health has changed throughout the years? Vanessa, we'll kick off with you.
Thank you, Connie. So mental health in our day and age, I feel that has become a lot more less taboo in these recent years. It's not seen as something that you seek only when you're feeling crazy or have a more severe diagnosis like schizophrenia, for example. More and more of our population has opened their minds up to the option of seeking help for their mental health, even if it's just to make sure that they're in the correct mindset at this part of their life. I have many people who will call and say, I don't know if I really need help, but I just want to, I feel that I would benefit from speaking to somebody who has an unbiased opinion and can offer me a different perspective about where I'm at in my life. I'm also really proud to say that we have a really huge increase in the younger population of seeking help. I'm always amazed when I have parents bring their teenagers in and say, well, my teenager has been asking me to set up an appointment with a counselor. That really amazes me. I'm really proud of those teens. Also with couples who are in their early 20s, sometimes married with kids, sometimes not married and very early in their relationship, and they're still willing to open their minds up to the option of, hey, let me go talk to somebody. Let's check to make sure that we're doing everything okay in our relationship right now. So I do applaud our younger population for that, for opening their minds up to this option of mental health. Michael.
I'm sorry, Connie. I can't hear you.
Michael, I'm sorry.
That's okay.
Same question for you. How do you think the perception of mental health has changed throughout the years?
You know, I think that Vanessa's spot on, but I would also tell you that there needs to be a lot more work done in the medical community with mental health and behavioral health. There's a lot more resources, I think, that are required to care not only for the behavioral health population here in San Antonio, but across the United States. I think that more work needs to be done with social services, with affordable medications, with medical facilities that are dealing with mental health crisis. I would tell you that you know, because of the lack of resources, many mental health people end up being pushed out to the streets, and that's not good for any community. So it's great that we were recognizing the importance of mental health in society, and I think now we need to get caught up on the clinical side of the world and focus on facilities that will handle that population.
Absolutely. And if I can just add too, unfortunately, because of this situation, we have many people who do need help and will give up after they call one or two people and it's an old phone number that providers aren't offering services anymore. They've moved or they don't take their insurance. And so I get many calls from people who they end up giving up. And if I can't work them into my schedule, I'm always sure to tell them, please don't give up. Don't take this as a sign that you don't need to ask for help. Please stay diligent. And I always try to offer them as many resources as I can because I don't want them to just say, well, I guess it wasn't meant to be.
Right.
Great, thank you. And so at the start of this year, a lot of people had a lot of hopes and dreams for the year 2020. And then about 3 months in, we got the shock of our lives and are now more than 6 months into a life-changing pandemic. And so we're at the 6 mark. How do you think today and where we are compared to March or even May compares? Michael, I'll start with you.
Yeah, I think that's a really good question. I would tell you that fear and anxiety are real issues, especially in a new disease and a new pandemic. People are worried about their own health. They're worried about the health of the ones that they love. There are folks out there who are anxious and worried and fearful, and they have chronic health problems and conditions. And some of those folks are mental health patients, and their conditions are worsening the longer the pandemic draws out. So, it's important that we continue down the path that we're on, but it's also important that we recognize that there is a need to go to the hospital. If you're having a mental health crisis, that is a medical emergency, and you should seek immediate medical help, whether it's at a psychiatric hospital or whether it's an emergency room. The same thing with chronic conditions, fear and anxiety. If you're a person suffering from chronic heart disease, that can just exacerbate your disease process, and you need to be treated. And being locked up in your home would simply only make conditions worse for you. So we just need to be mindful of that, right? It's a balance between making sure that we're tampering this pandemic down, but also making sure that we're taking good care of ourselves.
Mm-hmm. Absolutely.
And so, Vanessa, same question for you. How does today compare to where you believe that we were when this pandemic started 6 months ago?
Well, since everything is just up in flux and we really have no control over what's going on in the world, for this pandemic and when it's going to get back to normal, I feel, yes, fear and anxiety is definitely a big one. And I feel right now, because everything's out of control and we don't have that sense of security, people are less likely to pay attention to the big red flags or warning signs that, hey, something might be wrong. I might be experiencing more depression or more anxiety, or have never had depression or anxiety, and I'm now experiencing that because everything is just in flux and the world is constantly changing and we don't know when things are going to get back to normal. So since the world is not normal right now, we don't catch on to those signs that, hey, I'm not really acting normal right now. Somebody leaves a t-shirt on the floor and I might lose it over the t-shirt. And that's not a normal reaction, but I'm not able to have my mindset that, hey, that's a red flag that I might need to talk to somebody. I'm justifying that, no, I'm angry at that because the world is crazy right now. And so, yes, I feel that people are not really mindful of different triggers that we're experiencing or different mindsets that I'm in right now, because I feel that the world's different, so it's okay for me to be different. But we still need to check in with ourselves and make sure we're monitoring our emotional expression, our behaviors, and if something seems out of whack or something seems a little bit different, check in with yourself.
Great, absolutely. And so, Michael, over the past several months, we've seen a lot of different changes with people having access to the hospital, and when we were really in our peak with COVID-19, some appointments and some surgeries and things like that were put off. And so some people were not able to access the hospital or their appointments as readily as they would have hoped. So how can people, still take care of their mental health during this pandemic, even though some restrictions may be in effect?
Right. Yeah. So we're back into, I would tell you, normal operations, and I'm very proud of Mission Trail and our participation during this pandemic. At one point in time, 56% of our inpatient beds were dedicated to the COVID-19 patients. That accumulated some greater than 6,000 patient days taking care of these patients. But the good work the public is doing by wearing masks and social distancing and washing their hands, those numbers are going down, and they're going down every day. So we are seeing an increase in patients who want to come in now and have that elective work done. And that elective work is, I think elective is an interesting word, but I think it's urgent work that needs to be done. So we're seeing an increase in that, and I think it's important, especially with a population that needs to have, an example, a colonoscopy or an endoscopy, or they've been putting off that knee surgery, that hip surgery, so they're living with chronic pain. Then on top of fear and anxiety, it doesn't help them. So we're opening our doors back up, and we're in full swing, I would tell you, and still have beds and capacity set aside to continue to care for those patients who are suffering from COVID-19. We do have still have a little bit of restrictions on visitation. We have policies for one designated visitor, and the way we look at the designated visitor, and that's someone who's going to really assist in the healing and care of that patient while they're in the hospital, a support mechanism, because it's important that at this point in time that we respect the staff, right? So we just can't have everybody coming to the hospital and exposing our staff to a lot of potential, right? So we're being very mindful of that, knowing that not being able to come and visit someone that you love in the hospital is stressful in itself. It's also stressful for that patient. So it's a fine balance, but as things settle down and I would say cool down a little bit, we're becoming more and more open to allowing the population to come back into the hospital. I would tell you, the hospital should not be a fearful place for anyone. We have very good safety policies. We have very good screening policies. We have hardworking, dedicated staff, nurses, respiratory therapists, physicians who are doing a really great job. We have an infection control practice and process that is number one, bar none. So you're safe in a hospital. And if you're suffering from those chronic conditions and you've been putting things off, you shouldn't anymore. You should contact your healthcare provider and move forward with that care that you need.
And thank goodness in this day and age that we do have technology, and so there is still telehealth, and now there's also several doctors and nurses doing so over video conference, and so I'm sure that's helped tremendously. It's not in person, but it's still something rather than getting no attention at all.
Mm-hmm. Absolutely.
And so, Vanessa, if you can touch on how kind of your normal business model has been affected, but then again, you've still been able to continue and meet with people throughout this time.
Yes, so we are considered, we can still meet with people in person. I can still see clients at my office, but just to keep everybody safe as much as possible, I try to use telehealth as much as possible. Luckily and thankfully, almost all the insurance plans that my clients have had are able to accept telehealth and offer either no copay that's waived right now or a very reduced copay, which is great. So my business model has been altered in the sense I'm not seeing everybody in person. I'm doing a lot of telephonic sessions, so not able to see the reactions, or they can always see my reaction, or we'll speak over each other. I get that. I hit that a lot because we can't see each other. The video is more conducive to therapy, but sometimes that's not an option for everybody. So it has definitely changed the way that I provide therapy. I never wanted to do telehealth starting out, but it's a lot more convenient right now, and it keeps everybody safe. So I try to promote it as much as possible, unless someone does really need to come in to see me.
Well, thank you. I think this is a good time. Forgive me, I have not thanked both of you all. You all definitely are both essential during this time, and you all have had to remain extremely flexible to continue to help the people in our community. So a round of applause. I appreciate what you are doing for the community. And we started this pandemic when the school year was wrapping up, and I think most of us thought that all would be back to normal by the time the new school year started, and here we are. We just started September, and it's not so much. And so, as we all know, school is back in session. Many continue to learn remotely. Vanessa, it can be difficult for both parents and children alike. What advice do you have first for the students, for the children returning back to school?
So for the students, if it's an option, please take advantage of your live classes or your pre-recorded classes, even if it's not mandatory. I know a lot of schools, especially for high school, it's not always mandatory to sign into your class, but it's difficult to teach ourselves new material. I know for me, even it's still difficult to teach myself new material, so I can imagine these students. So if you have those resources, sign into your live classes, sign in, watch all your pre-recorded classes, take advantage of all the resources that you have. Another big one is don't procrastinate. It's really easy to procrastinate right now because right now we're on our own time. So teachers on in front of us, parents are busy with schoolwork or with their work, easy to put things off. So make sure that we're not procrastinating because it might feel good in the moment, but next week, next month, I'm going to be that much more stressed because I'm trying to keep up with my current tasks and also play catch up with everything I fell behind on. So don't procrastinate, which is always a general rule all the time, but even more so right now. Virtual learning is hard enough. Don't make it more difficult on yourself. Don't be your worst enemy. Help yourself out. And lastly, be patient with your parents. Parents aren't all teachers, and they're not always going to know the right answer or the right way of solving problems. Even me, I've seen now the way they do some math problems, and I have no idea where these different methods are coming from. I have never seen that before. So I know those parents are struggling because right now the way that students are being taught were obviously a lot different when they were in school. So be patient with your parents when they're trying to help you out. And if one or both of you get frustrated, take a break. Take a 10-minute break, go get a snack, go get a drink of water, go walk outside to get some fresh air, even if it's a little hot, just for a couple minutes, and then come back, regroup, and get back to it. Don't push yourself to keep going if we know that we're just too frustrated because I'm going to make more mistakes and I'm not able to focus either way. So it's me pushing myself harder. It's just a waste of time. Take 10 minutes. Step away from the computer, walk around the house, and then get back to it.
And kudos to the parents. I think some parents are wishing that they were able to go back to the home just to get out for a little bit. And so what advice would you have for the parents that are still working full-time with having to be teachers full-time, babysitters? They're having to cook and clean, all of the fun stuff that I'm sure that they are ready for it to be over. What advice would you give our parents?
So for our parents, same thing with our time is take your break as well. You also need downtime. You can't be on it 100% every single second of the day. Yes, you have a second job. Now we're teachers on top of my normal 40-hour-a-week job. So it is a lot. So make sure you are scheduling yourself some downtime, whether it's just in the evening, the last hour, or maybe I get up a little bit earlier before I have to clock in so I can take a walk outside, or just take my time having my coffee and listen to music or watch some news. Schedule yourself some alone downtime so that you feel that I still have my life. I'm still able to enjoy my life at this time, even though everything is very stressful. Also, make sure that you're actually clocking out from work mentally. It's easy sometimes working from home to, oh, I forgot this. Let me send this email, or let me just finish this up. And you're working till 7, 8, 9 o'clock at night. We need to be able to not only physically clock out, but mentally clock out. Focus on you and your children, your family, and having that quality time. Don't just feel that it always has to be work or else you're letting your family down. Not at all. You need to take care of yourself. If you're not taking care of yourself, you can't be there for everybody else. So make sure you're monitoring your irritability or your stress level. Exercise if you can, or just get outside for a short walk. Try to have that relief. You can journal, read, just schedule some downtime for yourself. It's very important. Don't feel that you're taken away from the family. No, you need to make sure that you're taking care of yourself to be there for your family.
And Michael, your staff don't have the luxury of, I'll put that in quotes, a luxury of being able to stay at home. And childcare is an issue today. And so how are you all as essential workers that are working several days of the week, very long hours, having to deal with the balance of still being a parent while their children are having to learn at home?
Yeah, I would tell you for nurses and respiratory therapists and all the other healthcare professionals that are working here in the hospital acute care setting, it's been very difficult when you're used to sending your child off to school so you can go to work and provide care for the community, and not being able to do that. So, we're really trying to work with our staff and be accommodating as much as possible, and try to not think in traditional healthcare terms where a shift is 7A to 7P. or 7P to 7A or shift like that. But how do we relook at that? So parents who have, especially the younger children that need the parent there at home to help assist them. How do we relook at the way we practice healthcare to help support that? Nobody anticipated that, so I think we're learning along the way. But it has been very difficult. If you look at this pandemic, it's been very interesting for not just healthcare workers, but those folks on the front line. When this all started, if you all remember back, the big issue was toilet paper, right? And so for someone who worked all day long, 12 hours or 13 plus hours in the healthcare facility, and to go to an HEB or to a Target or wherever, and you can't get toilet paper, got very difficult, right? And just fear and anxiety about what you can do. And so it's been a really, now we're into the school side of it. It was, food shortages at one point in time, and lots of fear and anxiety. So it's been a roller coaster ride for healthcare providers, but we try to do our very best in supporting them and dealing with these changes in a very non-traditional healthcare way.
Absolutely. And back to the point of early on when there was a shortage of several necessary items, a special thanks to those entities and the local grocery stores and things like that were able to or try to adjust their hours specific to first responders and our healthcare workers.
Yeah, I would tell you South San Antonio really stepped up. We had restaurants who decided to open up small grocery stores and really spent time trying to cater to healthcare providers, and it was very, very helpful. Major retailers here in San Antonio really stepped up and tried to accommodate by special hours for healthcare workers, and really took that stress and pressure off. So I'm very proud of South San Antonio and stepping up and supporting not only Mission Trail Hospital, but Mission Trail Baptist Hospital, but other healthcare providers here in the area. So kudos to them, and great job.
Absolutely. Vanessa, we received a question from a parent who is feeling stress and anxiety, like I'm sure many other parents, about the different choices in front of them. And so she's asked, will her children pick up on the stress and anxiety that she's giving off?
Absolutely. Kids are very receptive to any influx emotions that we're experiencing. And unfortunately, lots of times if we are under stress or anxiety or feeling overwhelmed, it's going to come off as anger to our children. No matter if they're young children or older teenagers, it's going to appear that we're very angry with them. They're going to take it personal, of course. They feel that's directed at them. They must have done something wrong. So they will absolutely pick up on those emotions. So we need to make sure that we're trying to check in with ourselves, do an emotional check-in. Like I said, take your breaks if you can, and have some type of self-care routine. Like I said, exercise before, and that's really one of the best things that we can do for ourselves to help relieve these symptoms of stress and anxiety. And if in the evening doesn't work for you because you have to start cooking or help with homework, things like that, maybe 2 days out of the week, wake up maybe 30 minutes earlier. Give yourself 5-10 minutes to get dressed and go for a walk or for a jog if you can. It doesn't have to be very long. I don't have to be gone for an hour. 15 minutes of a walk or jog is better than zero. Anything is better than zero. And don't feel that I have to get up early every single day. Start with 2 days, or maybe 1 day during the week or 1 day during the weekend. Or I'll do one morning and one evening. It doesn't have to be all or nothing. Our time can be very flexible. But when we're experiencing anxiety, we have a very fixed mindset. So we feel that it's either all one way or it's all a different way. So I feel I can't do anything at all. Not at all. I could do one walk in the morning, one walk in the evening. So make sure that we're taking care of ourselves. If we have history with anxiety and we've learned coping skills before by getting help with our mental health, whatever's worked before will most likely work again. So don't forget those coping skills that we've learned. And if we haven't learned any coping skills yet, seek a professional out. Talk to somebody, even if it's just a couple of times. Lots of times people don't seek help because they feel, well, I don't have the time to commit to having a therapy session once a week for the next 10 to 12 weeks. You don't have to commit to 10 or 12 sessions. Tell yourself you start out with 3 sessions, once every other week. 3 sessions seems a lot more logical, and it seems like something that I can do with my time once every other week. And after 3, I can see how I feel. If I want to just meet with that professional once a month, again, is better than zero. Anything is better than zero.
And Michael and Vanessa, whoever wants to take this next question, same thing with being a parent and your child picking up that possible stress or anxiety. As a leader in your organization, as a boss of human beings, I'm sure the same kind of goes. And so, Michael, if you kind of want to talk about that, you are leading one of the busiest hospitals in San Antonio. And you, I'm sure, are doing so with grace, but talk a little, if you want to give a personal story, if you don't mind, on how you've had to adjust and make sure that you're still kind of keeping your cool for the rest of your nurses and doctors that are also overwhelmed.
Yeah, I think that's a great question, and it can be difficult. But I would tell you, going back to some of the things that Vanessa said, I think it's important to eat right. I think it's important to get rest, to be intentional about the time that you take off away from work. I would tell you to avoid excessive alcohol use. I would also recommend, and something that I'm learning to do is not watch the news so much. There's so many swings in the news and what's being presented to the public. Try to find that one source of truth that is consistent, and what you're looking for, whether it's a CDC website or something along those lines. But news cycles can they can wear you down because they shift from one day to another. What I love to do, and I tell you, and I round on my employees a lot, and I like to talk about my family. That takes the tension off and makes work more personal. But one thing I do is every day on my way home, I talk to my brother. My brother's a truck driver, and so I'm able to talk to him on my way home, and then I call my mom. My mom is 87 years old, and she's cooped up in a house. She's a high-risk population, and she needs to be. Isolated and protecting herself. But it does my heart good to talk to my brother and my mom every day. And then there's other outlets. There's social media. There's ways to connect with the community online, just like tonight as an example, that can help reduce that stress and fear that we're all feeling. It's not just limited to folks who are at home and having to take care of kids. Everybody has these fears and anxieties as we go through this pandemic.
Absolutely. I think Vanessa might attest to, if so, don't say it on here, but I probably FaceTime or call her sometimes.
Definitely.
Vanessa, do you have anything else to add? Again, focusing on being a leader in an organization, being a boss of human beings, and some tips to not let the personal side kind of get the best of you in your work life.
So I definitely agree with what Michael said, is taking care of our basic needs first. Food, water, sleep. He's absolutely right. It's a lot harder to stay mentally healthy if I'm not physically healthy. So definitely take care of our physical health and our physical needs. Also staying social, like he said, as much as possible through distant and safe means. So whether it's group video chats once a week or once every other week, calling and texting, like he said that he calls his mother and his brother almost every day. That's amazing. That's perfect. So that they're getting their needs met, they're able to be social, and then you're getting your needs met as well. Also having a change of scenery when you can. I know for me, my new office is my dining room table. So every week I pick a different chair that I'm going to sit at for that week. So sometimes I'm facing the window outside, sometimes I'm facing my kitchen, sometimes I'm facing the living room. So just a little change in scenery kind of helps break up the monotony of the day-to-day and make me feel like, okay, something's a little bit different today. So trying to change up your routine little pieces at a time makes a big difference. Also, giving yourself something to look forward to. Our days and our weeks kind of seem all blended together, and everything seems the same from day to day sometimes. So if we have something to look forward to, whether it's every other weekend or every weekend, that makes us feel that we still have a life and we can do things to enjoy it. Whether it's I plan a picnic to do next weekend, or this Friday I'm going to go pick up a fancy dinner and we're going to have a fancy dinner here at home and rent a movie. Having those little things to look forward to makes a really big difference with your mindset.
Great. And Michael, you mentioned your mom. And so we talked about children, we talked about adults, but our senior population, is someone that we need to take into consideration. And so what are some warning signs, some risk factors that older adults and maybe adults with disabilities may be experiencing in regards to emotional stress or anxiety?
Yeah, so loneliness, right? If you think about what's happened across the United States over the last 6 months, is those folks who are living in assisted living homes or retirement homes, in nursing homes, they have lost that touch, and seeing a family member because of restricted visitation and things like that. So loneliness is a real issue. And so those things will go over and cross over into the home as well. So, and when you have fear and anxiety and you're lonely and you're depressed and you have chronic disease, it just exacerbates it and can actually make it worse. So it's important that we recognize that in our elderly population and be there for them, but be there in a safe way. My mom lives in El Paso. I've made several trips to El Paso since this pandemic started. My wife and I are very careful around my mom, so we wear a mask. We can wash our hands and we social distance. But just the presence of us being there and having that human connection that we were wonderfully designed to do makes a huge difference. And so we can't forget them, right? I'm glad to see across the nation that visitation in nursing homes and assisted living homes is beginning to open up. I think that the human interaction is very important, right? Because it will affect the health and well-being of our aging population.
Vanessa, did you have anything to add regarding the senior population?
So I do agree that loneliness is a really big struggle for them right now, which can contribute or lead to them having depression. So yes, we definitely need to check in with our senior population or senior loved ones or disabled loved ones. If they do live in town and we can schedule a drive-by once a week or once every other week, that can make a big difference. Even if they can't come and we can't physically hold each other, just to see our faces there in person really makes a big difference for them. And also not forgetting to check in on them. Call them, even if it's just for a couple minutes on my lunch break or after work for driving or just at home, just to call and check in on them and let them know that we're thinking about them. And for the senior population, disabled population, since they are at higher risk for symptoms of depression or higher fear and anxiety, need to make sure that they're keeping up with their doctor's appointments and keeping up with their medication. Don't fall behind with their physical necessities because, again, if we're not physically healthy, it's harder to stay mentally healthy. So make sure that they're keeping up with themselves, and as their support system, them being our family, make sure that we're asking those questions too. Did you take your medication on time today? Are you running low? When's your next refill? When's your next appointment? To make sure that we're helping them stay on top of it, because we don't want them to not want to worry us or stress us out and then fall behind, and then they put themselves in a worse situation.
Let's hold each other accountable. Absolutely. Mm-hmm. So we talked a lot about what to do when you feel that you're stressed out or far too anxious. But early on, we stated that some people don't know or can't identify those signs. And so what are some of those signs, Vanessa, that may lead people to seek help or should seek help for?
So right now, the biggest sign during these times of quarantine and COVID that I've seen has been irritability. It's the biggest number one sign that I've seen across the board are people being easily angered and getting easily frustrated. I'll have clients call me and they say the reason for coming in is they're talking about how angry they're getting and they're aware of it, but they can't stop themselves. They know that they're overreacting and they know that they're snapping too quickly, but they can't stop themselves. So being more easily agitated or irritable is one big red flag that we may need to talk to somebody, or I may need to address my mental health in some way. Also, if we're not finding joy in the things that we used to find joy in, whether it's talking to family or getting food from a different restaurant or a movie or video games, whatever my hobbies are, they're not bringing me joy anymore. That's also a big red flag that I might be experiencing some symptoms of depression. If we're not, we have irregular sleep, we're not eating like we used to, or self-care. Some clients are not showering every day or showering as regularly as they should, not brushing their teeth, just not taking care of themselves like they used to. And it's easy sometimes to make excuses. Well, I'm not leaving the house, I'm not doing anything or talking to anybody, but self-care is still very important. So if I know that I'm falling behind in my self-care, that's also a big red flag. And expressing or having constant irrational thoughts or fears is also a big one. Yes, we're all experiencing fears and irrational thoughts with what's going on, but I should be able to compartmentalize when I'm focusing on the world issues and when I'm focusing on myself. If I'm not able to separate the two, I'm not able to focus on my task at hand because of my irrational fears, probably a big red flag that I need to talk to somebody or address my mental health.
And Michael, you all at the hospital are mostly dealing with people who are not probably the most excited to be coming to the hospital, and probably more so in the emergency room. And what are some signs and something to alert you all and your professionals for people to seek help?
I think it goes along the lines that Vanessa's talked about. Is we'll note it right away. We get many times the extreme. So folks who are coming in who have suicidal thoughts or suicidal tendencies, those are real medical emergencies, and we have to address those. Others may be just social issues that we need to help them through if we can. We do have a very good behavioral assessment team in the Baptist system that's able to help us navigate some of those problems. But I would tell you, just fear and anxiety in general has really changed everybody who walks in the door. There's a fear of contracting COVID-19 by coming into a hospital. There's just walking around in a mask every day, social distancing every day is fear and anxiety within itself. So it just adds on. It adds on to the hospital visit, right? If you look at our emergency room staff and our physicians, right, a normal patient visit triage is completely different than it was pre-COVID, right? So now we have to consider that there's a percentage of the population who are walking around, they're asymptomatic, so they have no signs and symptoms of COVID-19, but could be could be positive. So there's fear and anxiety on both sides. And so we're trying to do our best to make sure that we're empathetic to those coming into our hospital, try to relieve the fear and anxiety that they have coming into the hospital, and then try to provide the very best care in a safe manner to those patients during this pandemic. It's very interesting. It's waters that we've never been in before, and we're learning rapidly. But I would tell you, I think we're doing an outstanding job.
I think so too. I do want to pivot to some good news and would like to spotlight you, Michael, you and your amazing team at Mission Trail Baptist Hospital, our healthcare personnel, our first responders. You all are the real heroes, and you're a hero too, Michael. You've been leading your team at the hospital day in and day out, and you were recently awarded a Healthcare Hero Award by the San Antonio Business Journal. So congratulations to you. It's a team effort. Yes.
Thank you. And really, that award is really not about me. It's really about the hard work that the staff here at Mission Trail put out each and every day. We have wonderful, dedicated nurses and respiratory therapists and food nutrition workers and environmental care workers and physicians who each and every day come into the hospital and do the very best they can to care for South San Antonio. And I'm very proud of that. I just really am. So that award, although the accolade is toward me, it really demonstrates the hard work and dedication that the men and women, nurses, and healthcare professionals here at Mission Trail deliver to the Southside community each and every day. So thank you, but really the thanks goes to my team.
Absolutely. And so your awesome team, can you talk about some ways that you're assisting your employees as they, deal with stress and build resilience? They're having to keep a smile on their face for the sake of the patients coming in, but I'm sure that they're also dealing with that behind closed doors. So how are you assisting them?
Sure. That's a great question. And I think it starts with being available. Myself and my chief nursing officer, my chief operating officer, my chief financial officer, we spend time in the hospital. I think it's being available and sometimes just listening to our staff's concerns and addressing those concerns, because fear is real, right? And if you adhere to Maslow's hierarchy of needs, right, the need to be safe is the second tier in those hierarchies of needs. And so being out there and listening and being available shows general concern, which we all have, because we want our staff to be safe. We do a lot with rewards and recognition, and we do a lot with rounding and passing out candy and food. It's always a game winner. We'll try to be as accommodating as we can with needs and time off. We started early on, again, working with the businesses here in South San Antonio to make sure we provide food and basic needs. We work with the local hotels to provide a place for our staff to stay should they feel uncomfortable because they spent the last 3 days or so working in a COVID environment, to feel comfortable by staying in a hotel, so they don't put that concern or the concern of infecting their family on them. So we've done that. We've worked with daycare centers to help provide childcare. I think we've done a lot, but there's just so much to do. Again, it's a brand new territory for us, and every day brings something new. But it really comes down to taking care of your employees and being available for them. I love Mission Trail Baptist Hospital staff. They're very dedicated. I'm very proud of our turnover rate, which is less than 6% here at Mission Trail, which is kind of unheard of in healthcare, because especially in San Antonio, people move around and they have significant others in the military, and they get transferred, and healthcare is very dynamic, and folks get new skill sets and move on. But the folks down here on the south side of San Antonio are dedicated to the south side of San Antonio. And many of them don't live down here. They just love the community, like I do. So those are a few of the ways that we help our staff along. But I would tell you the number one thing that we can do for our employees is have personal contact with them, have a human relationship with them before you have a business relationship with them, and it goes a long way. So.
Absolutely. And so, Vanessa, some of us may have good poker faces, if you will. So what are some questions that you can ask someone that you may suspect is dealing with mental illness?
So we can start with, I guess, just first off, if there's part of our support system, having that regular communication. Because if we're speaking to them on a regular basis, then we'll start to see that things are changing for them. But good questions are to ask: what does their routine look like? Are they staying in bed all day on their days off, or sleeping more than they normally do? Are they not eating like they should? What is their normal routine? Do they have a reason to get out of bed if they're not working right now? Things like that. So asking just, what does their schedule look like? Have they been able to get out of the house? Yes, we need to stay safe and stay socially distant, but we need to get outside as much as possible too. It's not okay for us to just isolate ourselves and stay inside all day, every day. Even if it's just walk around the block. Just walk around the block, that can make a big difference. So ask them, hey, when's the last time you left the house? When's the last time you got out? Or when's the last time you talked to somebody? Have you been video chatting, texting, calling friends or family members? So making sure that they're still interacting, especially for those of us who are extroverts. Right now, it's a really big struggle because we don't have that social outlet. So we're more susceptible to symptoms of anxiety and depression because one of my outlets been taken away. So if we know that one of our family members or friends is an extrovert, make sure we check in on them and try to do a video chat or try to talk to them as much as possible so they still have some type of outlet, even if it's a drive-by once a month, so I can see and wave, and so we still get that outlet a little bit. Not as much as we like, but at least some of that social aspect is fed just a little bit. So yes, asking them about their normal routine, what are they doing day to day? When's the last time they got outside? If we know that they're one to always exercise and they're not anymore, that's going to be a big red flag. So asking them, have you been active? Have you been watching your workout classes online since you can't go in person? asking questions like that to make sure that they're still doing things that they normally would do when everything was out and open and normal.
Yes, and it could be a sensitive topic. And so one word I might use to describe myself is a bit blunt sometimes. So you know that you have to have a different approach, or I would expect that you need a different approach. And so that's something that's I commend you on in your craft. And so talk a little about the approach and how not to offend or stress that person out even further when you're trying to do something good.
So you don't ever want to tell them that you need help, something's wrong with you. So that's why you want to start with asking questions to see what's been going on from the day to day. So they're giving you information instead of you telling them what they need or do not need. And also expressing your own stresses, your own worries. So they know, hey, it's okay for you to talk about this because I'm feeling the same way. Yesterday I woke up on the wrong side of the bed and I was in a bad mood all day. I could not shake it. Telling them those stories of when you're feeling upset or anxious or worried so that they know, hey, it's okay for me to talk about this and they're not going to make me feel bad or they're not going to judge me for it or criticize me for it. So let them know when you're struggling too, or give them examples of when I was easily angered or triggered, or I got emotional watching the news. Giving them examples like that from your own personal day-to-day will make them feel more at ease that, okay, it's okay for me to talk about this too. Even if you do want to suggest them seeking out a professional, talk about maybe a time when you have sought out a professional or somebody who has, so they know it's not taboo. I'm not saying that you're crazy. I'm saying, hey, maybe this is an option. And even offering up the advice or the option that there's telehealth available everywhere. So letting them know, hey, you can't leave the house. You're not feeling safe to go out there in person. You talk to somebody over the phone. The video chat's really easy. And maybe just try it one time. If you don't like it, don't have to go back to it, but maybe try it one time. So it's more asking questions instead of telling them what they need to do. And then more talking about yourself will help them feel more at ease and want to open up.
So Michael, if someone walks into your hospital and is needing mental health assistance, what are the steps or questions you and your staff take to make sure that they get the help they need?
Yeah, so if we have a very good triage process, I would tell you if the patient is in crisis, has or considering suicidal tendencies, that's a medical emergency, and we treat that like it is. And again, we have a very good behavioral health assessment team, and these are professionals that are skilled in working with behavioral health type patients. So we will treat them in the emergency room and let them be evaluated by that team to include a psychiatrist. If those patients need to be placed, we have geriatric psychiatric care available in our system at two of our facilities, one at Baptist Medical Center and the other at Northeast Baptist Hospital. And they take patients that are 55 and older. Those patients are screened before they get into the unit for COVID-19 to make sure the unit is safe. Those patients who may screen positive, we treat them and guard them on the medical ward until such a time they can join the rest of the population. And it's important. It's important that we do that. But I will tell you that with that said, there's a great need for behavioral health beds here in San Antonio, especially for the adult population. And the care and attention that they need cannot be completely taken care of in the emergency room. We can take care of that emergency, but there needs to be extended care after that, and that's difficult from time to time. And so, as I mentioned earlier, there needs to be, as we recognize that mental health is a real issue, there needs to be that same effort put into social services and medical facilities and affordable medications, and helping those folks who may not have the funding to be able to make it through this disease process and to be active in society. So we need to do a much better job at that. But I think we do a very good job with it, but it is not complete across San Antonio, across Texas, and across the United States. A lot more work needs to be done.
That's a great point, and I think somewhat of a silver lining that has come out of this pandemic is that several employers and businesses, organizations have really stepped up how they're supporting their staff when it comes to behavioral and mental health. And so talk a little about that. And it probably was needed several years, decades prior, but I do see it happening now. And so Vanessa, if you want to talk a little about how great that is to see for people.
Yes, from the corporation aspect, I've seen a lot more companies have in place an employee assistance program, your EAP. So your EAP offers a number of services, and one of them is offering free counseling services. So I'm really proud of these big companies and even some small companies offering these services to their employees, and they don't have to have full coverage insurance. I don't have to be an employee there for 90 days in most instances. I get these benefits just for being an employee working there. And I get a lot of clients who take advantage of those services. So it's free to them. They already get the service just by working there. So why not take advantage of that? Even if it's just a check-in with yourself. Like I said, I'll have clients that say, I don't know if I really need therapy, but I might benefit from talking to someone. And hey, this is free. It's free. You get this as a service for being an employee there. Take advantage of it. So it is really nice to see a lot of companies provide these services for the employees. I think it goes a long way.
Michael, did you have anything to add on?
Yeah, I'm glad Vanessa brought that up. We have that right here. I'm in the medical office building right next to the hospital, and we have an organization right here in this building that offers free support for those who need it. I would also tell you across our system, we have a very good pastoral care program, and with wonderful people who can help people through crisis, and if they can't, direct them to where they need to go and help navigate that. And I think it's very important that we keep those programs alive and keep them up front so people will utilize those services and not feel shunned or guilty or bad about using that. This is these are interesting times. No one ever expected to go through a pandemic, right? It certainly wasn't on my bucket list, right? But we're going through it. And so now it's moving away from the idea of emergency management, dealing with COVID-19, right, to living with it. And so what do we need to do as society to help every person in society be able to cope with the fear, the anxiety, and living with COVID-19 until there's a vaccine or meaningful therapeutics or agreed upon therapeutics for this disease.
So we talked a lot about holding each other accountable, checking in with our friends, our family members, but there is that portion of holding yourself accountable. And so if you do, as difficult as it may be to decide that you are suffering from mental illness, what are some questions or tips that you can assess or ask yourself in order to make that judgment, Vanessa?
For one, if I know that I'm overreacting or even underreacting, sometimes I could feel numb to certain situations that usually would maybe hit a spark with me, and I'm just feeling numb. Then I know that, okay, maybe something's up. I need to do something different. If I'm lacking motivation, I know if I have the motivation to get up out of bed or to take care of my regular self-care or to exercise like I used to, or even talk to my family or friends, lack of motivation is a big red flag. And we all have our lazy days. Sunday I might just stay in my PJs, lounge around and veg out from the TV all day, and that's different. We usually can recognize when it's a lack of motivation because things are that much more difficult to do. It just seems like it takes so much more strength for me to get myself out of the bed and get into the shower. So if I see that big lack of motivation and things are a lot more difficult than they used to be, then that might be something that I need to ask myself, okay, maybe I need to check in with somebody. Also ask those around us, hey, I kind of seem like I'm feeling I might be behaving a little bit different. Do I seem more agitated, or do I seem more down, or have I seemed more quiet, or maybe more talkative because I'm trying to cover up other emotions that I'm going through? So check in with those that we do speak with, even if it's a coworker. It's a coworker that I have an okay rapport with, just asking them, in our last meeting or through my emails, do I seem different than I used to? So check in with those around us so that it's harder for us to look ourselves in the mirror and really notice when we're changing. day to day, but other people around us can see the difference. So check in with our support system or even coworkers, teachers that I might talk to that I have a good rapport with to make sure that everything kind of seems the same or if something's different.
Even those changes in sleep patterns, right? It is a big one when you find yourself where you can't rest your mind at night when you go to bed, and you find yourself waking up, and you're waking up fearful and anxious about what's going on in the world. That's a real sign that you need to take some time off, step back, be intentional about what you do when you're off, and take some time to really unwind, because it can build up and lead to other things. So very important. Sleep is very, very important. It's one of the first indicators that things just aren't going well. The lack of sleep.
Absolutely. And something also that can contribute to our anxiety, I think Michael mentioned earlier, was being overexposed to the news and social media. So we need to make sure we're not becoming obsessed with the news or obsessed with social media. Stay educated and stay informed, absolutely, but don't become overly obsessed. I have a lot of my clients where I limit them to, okay, you get to watch the news twice a day. Which 2 times do you want to watch? In the morning and the evening, or do you want to do a lunch in the evening? But just twice a day. Don't overexpose yourself, because that's constant trigger for our anxiety. And then, yes, and it's hard to sleep. It's hard to eat. We're sick to our stomach. So don't overexpose yourself to the news.
Or mix in some happy news. I know that there's some happy news or good news hashtags out there that you can consume. And so as we wrap up, I do want to ask both of y'all if you have any closing comments that you'd like to leave us with. Michael, we'll start with you.
Yeah, I would tell you, God bless you and take care of yourself. It's important that you take care of yourself first. You can't take care of other people if you don't take care of yourself. I do believe that there is a hope on the horizon. I don't think we were that far away from a vaccine. But in the meantime, keep connected, that human connection as much as possible. Make those phone calls. And I would tell you, social media and texting and all those things have taken the place of personal conversations, but a personal conversation, that human interaction, will go a long way. Don't forget to reach out to the ones that you love and let them know that you love them. Be that listening ear. It's important, and that folks know that you care about them. And I would tell you to keep your chin up. Keep on doing what you're doing. Wear that mask. A mask is important. Wash your hands, and social distance when you need to social distance. And it'll help dampen this thing down while we're waiting on that vaccine. But don't ever give up hope. There's always hope out there, and know that there's a God out there who loves you and who created you, and He will take care of us. And I really believe that. So thank you for allowing me to participate tonight.
Thank you.
Very well put, Michael. And the only last thing that I would add is don't be afraid to ask for help. Asking for help when we need it, or acknowledging that we need help, is a strength, not a weakness. A lot of us view asking for help as a weakness, and it absolutely is not. Being able to take that, check in with yourself and know that, hey, I might need to ask somebody for tips or advice, is a strength. So don't be afraid to ask for help. It's a positive thing.
Well, thank you both. I appreciate you taking the time to visit with us. A round of applause for our speakers, Michael Klein, the Mission Trail Baptist Hospital President and CEO, and Vanessa Bernal, a local licensed marriage and family therapist and licensed professional counselor. Thank you both for joining us tonight.
Thank you for having me.
Thank you, and God bless you and the ones you love. Be safe.
We hope this discussion provided some coping strategies and techniques to manage your mental health. For our viewers, here are those resources once again in case you or someone you know may need some mental health assistance. We hope that you enjoyed this live stream event. If you have any follow-up questions, our contact information is also up on the screen, and we will be sure to follow up to answer your questions. Our last Facebook Live event is scheduled for next Thursday, September 10th, when we'll be talking about COVID-19 and small business. So make sure to mark the calendar, save the date for our last Ask Brooke series. We will once again be taking your questions live, so please submit them in advance. Until next time, have a wonderful evening and stay healthy, friends. We'll see you soon.